Namaskar to all. Welcome to Saffron Educational and Medical Foundation, an opportunity to be your own doctor today.
What is according to the naturopathy, how the naturotherapist will help you in this disease, like how natural remedies are there that will improve your health, improve your muscle movements and rigidity also. So first one is the exercise. The best therapy from allopathy or any alternative point of view, exercise is always suggested for specifically the Parkinson problem, because over there the loss of muscle control is there, movements are restricted, circulatory system is affected, brain cells are affected. So the regular physiotherapist exercise or the body movement stretching exercise are there. So the different type of exercise that generally recommended according to the age and the condition of the patient. If the patient is bedridden, you cannot do aerobics with them. But if the patient is partially affected with the Parkinson disease, if their movements are comparatively good, so you can suggest them certain type of aerobic exercises. Along with that, strength and stretching exercise also helps very really. It shows a miracle in some patients. In our OPD and the last 17 years of experience, we had seen this type of patients really have the good improvement only with the help of exercise. Rest herbs and therapies are there, but very rapidly they had seen the improvement in their muscle control. Around 30 minutes of daily exercise and with the change exercise, this will definitely help you. Some agility exercise according to their age you can do. Like if the patient is quite young, so they have the capacity, their body movements are comparatively good, their tissues are comparatively very young, so they can handle the exercise very easily. Same thing if the patient is above the age of 60, they have some restricted movements because of the aging problem also. So agility exercise is also very important, very good thing that you have to keep in your mind. There are specific yoga. See, we have a good culture of yogic science. We are gifted with some really very knowledgeable Rishimunis and the yoga gurus, acharyas. They already mentioned before the centuries in some Veda or Grantha. Like there are certain type of yoga exercise which also help to improve this type of problems, to regulate and generate the exercise. In our Charak Samhita, Vagabhatta, so many very valuable grantha of Ayurveda, our Rishimuni already suggested a specific pose or the yoga exercise which really gives a miraculous result in this type of Parkinson disease. Let's see one by one. Basically, yoga deals with the nerve, mind, and it helps to manage the whole system. This is the beauty of yoga. It reduces the shaking, that is with the help of diversion. Face exercise are there. If you are facing the facial Parkinson, then lion pose. This is one of the best exercise for your facial problem. If the patient is suffering with the eye problem also, then eye exercise that is called the Tratak. Tratak means what? You have to concentrate on a specific point without blinking your eyes for a longer period of time. This will of course with the help of lots of it will take time, or it will take more time for the experiencing all these things, needs some hard work and a regular basis you have to continue all this exercise. So basically Tratak means exactly on the level of your eyesight with the gap of around 6 feet, there is a point. Generally we use a candle or the flame of candle or a big red circle, so that we can easily concentrate on that point specifically without blinking our eyes. So that is called the Tratak. That will help to build up your concentration and eyesight also, which helps the circulation around the eyes. It also helps to maintain the blood pressure of your eyes also. Tadasana and Ekapadasana is another yoga postures which helps in this problem. Some type of forward bending, backward bending, side bending, upper bending, lower bending exercises are also very much useful to make the whole muscular movement. So again, would like to say it depends on the capacity and condition of the patients. So there are different type of yogasana, the different postures according to the patient's age and condition. You can suggest like Parvatasan, Hastapadasan, Bhujangasan, Konasan, Vakrasan and Sarvangasan. Every asanas you have the most important to hold that position. Maybe for a fraction of second or a minute. It depends on the regular exercise that you are doing. Another some rhythm exercise is there. See, only the posture and exercise is not enough. As we know, we need oxygen to live, need regular breathing exercise also. That is called the rhythm exercise. So Anulom Vilom is there and Savasana is there, which helps to relax the whole body, to give enough oxygen to your brain cells. Along with that, it helps to detoxify the things like carbon from the body and other things also. So this type of breathing exercise really triggers our neurons, increase the dopamine level and makes the brain in proper functioning.